All right, thanks, Warren. Well, the cancer death rate, as we've recently reported, might be on the decline, but numbers with the disease are still staggering. More than 1 in 3 people, according to the American Cancer Society, will be diagnosed with cancer at some point in their lives. And this morning, we're talking with Gundersen oncologist Dr. Kurt Oettel because February is National Cancer Prevention Month. Dr. Oettel, thanks for being back with us.
Hey, thanks for having me this morning.
We're glad to be talking to you about this important disease. You know, as we kind of mentioned there in the intro, the rates, we're seeing them, are they decreasing or increasing? Because we're seeing the death rate, it seems, drop, but still 1 in 3 people?
Yes, so we are seeing the death rate drop in cancer. In fact, from 91 to 2005, that death rate has plummeted by almost 30%. And a big factor in that is the decline in the number of people smoking. I think that's one of the biggest drivers in that declining death rate. The incidence of cancer, the actual number of people getting cancer, particularly lung cancer, which really drives cancer statistics, has been dropping. So I think that's really where we're seeing the numbers change.
So smoking is one of those causes that we typically look at. What are some of the other common causes?
Well, actually today in our society, we're starting to see increases with the obesity rate. So obesity is, in the future, will probably replace smoking as the biggest risk factor for developing a cancer. Particularly, we're seeing an increase in things like hepatocellular cancer, cancers of the upper GI tract, or some colon cancers are rising.
So it seems eating healthy and exercising can help decrease your chances of getting cancer. But as this is Cancer Prevention Month, is there any way to prevent cancer?
Yes, so exactly what you said. Good lifestyle changes with more exercise, moderate diet, portion sizes, low carbs. You know, that's what really is going to change cancer statistics moving forward.
And we talked about lung cancer with regard to smoking, but I understand a common household occurrence, radon, is also a big factor in this. Can you explain a little bit how that works?
Yeah, so radon is an odorless gas. It's actually fairly common here in the upper Midwest, and it is the second leading cause of lung cancer for patients who don't smoke. It's something that we see particularly in low ventilated areas and basements. And there's good mitigation systems for detecting and getting rid of radon. And you can pick up radon detection kits at the local hardware store.
So a good time to maybe do that, get your home checked and check your
Absolutely.
lifestyle as we're, getting past the New Year's resolution point. Dr.
Yes.
Oettel, thanks for being with us this morning.
Yeah, thank you for having me.
It's now 9 minutes before 7 o'clock. Time for your morning sparks. And today's challenge is to have your child help you sort and put laundry away. Talk about the clothes, where they go. Are they the same type, color, season? And this helps build brains by teaching number sense as well as patterns and problem-solving skills, which are the beginning steps in understanding math. And we'll be right back to recap the day's top stories.